if you talk in that other book there, that's where they talk about doing it in a flexed position like this. But basically, what you're going to do is start out in a neutral position, and you're going to be putting pressure down. Okay? You want to start out with pretty light pressure, depending on the person you're dealing with. Okay? If you're dealing with a 350-pound linebacker with no neck, okay, you can put a little bit more pressure. But let's say, if you're dealing with some 90-year-old person that maybe just got in an auto accident, depending on the acuteness of the condition, you may just start with just putting your head like on this, and then you're going to gradually escalate the pressure, pushing down. Okay, so I'm not really going to push that much, but you're going to apply pressure. So this is a neutral position, so you're more or less kind of putting equal pressure almost on the, actually there's more weight bearing onto the disc portion or the vertebral body portion of the spine. So we're putting more pressure on that. And so what are we looking for? Either pain in the neck or pain radiating down. Okay? Now, what we talk about here and doing it in 3 different progressive positions here, which is neutral, like this, then you go into extension. So when I'm in this position now, what parts of the joints am I putting pressure on more? The facets, right? So I push down like this. Okay? Now I want to isolate more to one side versus the other. So I'm going to go like this. This is more or less like in a spurling position where I'm in extension, rotation to the opposite side, and lateral flexion to the same side. So now, and then you're going to slightly position your hand. So here you want to move up into this area here, kind of like that. So you can do it with 2 hands on like this. A lot of times what I'll do is I'll have my hands here along the facets. And then I'm pressing down like this because I can also, makes it easier for me to position the patient's head in exactly the way I want to do it. Because you may, say, okay, I want to be a little bit more here, I want to try this here. And then also, when you ask them where do you feel the pain, then you're already palpating right here and you can say, yeah, is that it right there? Because you can also, let's say if you're looking at a specific segment, why don't you turn around first? No, that's okay like that. So let's say now, because maybe when I was palpating or something, I found that this is where the tenderness was, I can actually have my hand right in there and kind of feel, I can isolate that different segment. As a chiropractor, we get kind of more into joint movements and palpation and things that you probably will do as an acupuncturist, but you can be more specific like that. Okay? And then, in addition to this, it talks about the 3 different positions. Then you can also do it more into a flex position like this. And supposedly that's going to be putting more pressure on the disc. And then you can also relate this to a mechanism of injury. Say, for example, somebody's looking in their rearview mirror, watching the car that smacks into the back of them. Okay? When my body gets pushed forward, my head snaps back like that. Which facet joint is going to get more affected? This side here, right? So the facet's going to get compressed when I do this way, and then it's going to get stretched, and maybe the capsule might get torn when I'm going back this way. Whereas this side may not be affected as much. So then let's say if he's got symptoms on this side, then you're going to want to, reproduce the mechanism of injury. So let's say, their head was turned like that, and then it got pushed into extension, so you're pressing like that, and then you're looking for symptoms on that side. So local pain here could just be a facet problem. Pain radiating down is going to indicate more something's affecting the nerve root, whether it be osteoarthritis affecting the IVF or disc herniation, things like that. It's not going to tell you exactly why it's radiating down the arm. This test just tells you that something's irritating the nerve root. Although if you're in this position here, you're more likely going to be compromising the IVF. So the IVF is going to get shrunk. Whereas this position, you're increasing pressure on the disc. So this is more likely to maybe indicate a disc herniation, whereas this is something to do with the facets. Or if you're going like this, you're affecting the IVF. And then when we talk about Jackson's test, basically it's cervical compression where all you're doing is rotation. So you're just rotating and pressing down like that. So basically, a positive finding to indicate nerve root problems is radiating pain. Okay? But another finding could just be local pain in the neck, where that's going to indicate, like we say, more of just a facet problem versus nerve root irritation going down. And then the same thing with Sperling's. So on all these tests, we're going to show the differential diagnosis. In this case, we're just listing one thing. I guess you could, if there was just local pain, then the differential diagnosis would also include facet syndrome or facet irritation, something like that. And then distraction test, let me turn back around. Maybe we could just do it this way, and you can just sit forward. So then okay, so now the distraction test, there's different ways to do it. A common way you're going to see it is putting the hand under the chin like that and pulling up. Okay? What if somebody has issues with their TMJ? Okay? Another way you can do that is to hook under the zygomatic or something like this. And the main thing, just turn a little bit this way, is that you can hook under the occiput. So really I'm putting most of the pressure here, and I can just pull up like that. Okay. So a lot of times when I show these different tests, there's going to be, quote, the textbook way that you see it commonly, which is going to be like this. Okay? I usually am going to do it something like this, because if I'm hooking under here, I got a pretty good grasp. All this is just to stabilize. You can feel that, right? Mm-hmm. So if somebody has radiating pain down the arm and that relieves it, that's going to indicate one thing, that basically you're taking pressure off of that nerve root. Okay, what happens if I pull up like this and it makes it worse? It could be muscle strain, it could be ligament sprain. So the ligaments could be torn and then you're stretching the ligaments. Okay? So if you're distracting it, the condition is something that has to do with compression, whether it's compression on the facet joints, or specifically, here we're talking about relief or decrease of radiating dermatomal pain. So that's indicating that something's putting pressure on the nerve root. When we pull up like that, it's taking pressure off. So it could be something like IVF encroachment, disc herniation, things like that. You know what I mean when I say IVF encroachment, right? It could be, you have the IVF, which is where the nerve goes through. It could be anything like osteoarthritis, like the facets are enlarged, they're putting pressure on that, or something's floating around in there, so a disc is putting pressure on it, or a free fragment of bone, something like that. What's that? Yeah, it depends what it was. Yeah, if the facet joint was inflamed, or if the disc was inflamed or enlarged. Yeah, the nerve root could be irritated and inflamed. Yeah.
So in this distraction test, you would test only when they have the pain radiating down, and you want to see if it's relieved by
Pretty much, yeah. Or at least if they had some kind of pain in the neck, you know. But classically, it's going to be for nerve root, but also like facet pathology or stenosis. Facet problems are only going to be local into the neck. And then here's the other shoulder abduction relief test. Basically, you just ask the patient to bring their arm up like that. So it can be relieved if you have herniated disc or nerve root compression, although sometimes certain things it can cause increase of symptoms. Like if there's something in this area here that's putting pressure on the brachial plexus, maybe it could be scalenes or something like that.